Go.
Okay, we're going to be talking about the adrenal gland axis, which is a part of the hypothalamic anterior pituitary target organ axis. So first, the stimulus is, the first one is cardiac rhythms, stress, injuries, infection, and anxiety. Will stimulate the hypothalamus at the hypothalamic neuroendocrine cells to release CRH, which is a peptide. It's hydrophilic and lipophobic. So it needs DAG and IP3 to stimulate the corticotrophs in the anterior pituitary. The corticotrophs release ACTH, okay? So, which we'll be discussing in the second part. So what regulates it? The levels of cortisol and ACTH, which is like a negative feedback onto this area, so they can inhibit CRH from being released. So the second part is going to be, I'm going to be discussing how the anterior pituitary, the corticotrophs, how that releases ACTH and how that affects the adrenal gland. But we're going to be discussing the adrenal cortex, which is the outside of the adrenal gland. And the adrenal gland has 3 different layers. The first layer is the zona glomerus. The second layer is zona fasciculata. The third layer is the zona reticularis. Okay, so the zona glomerus makes aldosterone. However, ACTH doesn't cause this layer to make aldosterone. It just helps with the growth and function of this layer. It affects the zona fasciculata by helping with the growth and function, and it also helps make glucocorticoids. And one of the main glucocorticoids is cortisol, which is a steroid. And the third layer is zona reticularis, which makes androgens. And so ACTH has different effects, and it causes, like I said, it causes the growth and function of all 3 layers. So if you decrease ACTH, there'll be a decrease in hormones. It also has a steroidigenetic effect, which causes the release of cortisol. Okay, so next we're going to be talking about the third, we're going to be talking about cortisol, which is released from the zona fasciculata, layer number 2. Cortisol is a glucocorticoid, which, when it's released, its effect is evident in minutes. And it's a steroid, and it's hydrophobic and lipophilic, meaning that it needs gene expression. So, cortisol is bound to cortisol binding globulin. There's 80% of it is bound to that. 15% is bound to albumin. 5% is unbound in the bloodstream. And from there it goes to the target tissue. Target tissues, the first one is skeletal muscle. The second one is liver. Third one is adipose tissue. The first target tissue is skeletal